Hello, this is Sarah Cronenberg from Inside Childbirth Education with a focus on maternal safety. Recent research published in April of 2010 in The Lancet indicates a significant drop in maternal deaths, which is encouraging news for maternal health advocates worldwide. In the United States, however, research shows that the rate of women dying in childbirth has at best failed to improve in recent decades, and at worst shows signs of increasing in prevalence. In countries where too few medical interventions are available, women have increased risk of death in childbirth. However, when otherwise healthy women are exposed to the risk of cesarean surgeries or induction without a distinct medical need, these women will also have an increased risk of death and injury in childbirth. While the high use of forceps during childbirth has reduced since the 1950s and 60s, the number of inductions, cesarean deliveries, and the use of vacuum extraction has increased. With a rise in the number of social or elective inductions to begin labor versus letting it start on its own, there are various risks to mom and baby, including increased risk of abnormal fetal heart rate, shoulder dystocia, and other problems with the baby during labor, the baby being admitted to the neonatal intensive care unit, use of forceps or vacuum extraction during birth, cesarean delivery, and increased risks to the baby of prematurity and jaundice. Cesarean delivery rates have risen 10% in a 20-year period, according to the National Center for Health Statistics. As of 2010, 33% of births in the United States resulted in cesarean delivery. While cesarean deliveries may be necessary in some cases, expecting moms should be cautious of recommendations for cesarean delivery unless absolutely necessary. Cesarean surgery carries the risks of any major surgery, including hemorrhage, anesthesia accidents, emergency hysterectomy, post-operative blood clots, major infection, and unresolved long-term pain. Babies face potential harms from cesarean delivery as well, including a higher risk of death in the first year, admission to intensive care units, prematurity, respiratory complications, and childhood development of asthma and allergies. There are several things that women can consider to reduce their chances of needing a cesarean, including choosing a maternity care provider and birth setting with a low cesarean rate, and be skeptical of recommendations for a cesarean that are not based on research. Let labor start on its own versus being induced. Arrange for a skilled labor support person, such as a loved one, doula, or midwife. Take a childbirth education course like Lamaze and be better prepared for a safe and healthy birth. When choosing their birth settings, expecting moms should know that a home birth is a safe option for healthy women, which is one way to assure there would be less chance for the use of interventions. Another consideration is whether or not an episiotomy is necessary during birth. According to Cochrane, the routine use of episiotomy is a harmful practice, and women who have episiotomies are at a higher risk for pelvic floor disorder. While routine episiotomies are no longer recommended, the procedure may still be warranted in some cases and is necessary with about 6% of births. A thorough review of these risks involved with induction, cesarean delivery, and the need for an episiotomy is important during childbirth education classes, so moms are prepared with evidence-based information. They know their options and can push for the best maternity care, resulting in a safe and healthy birth. This is Sarah Cronenberg reporting with Inside Childbirth Education.